Welcome to this lecture on Sigmund Freud and his theory of personality. His theory is called the psychosexual theory of personality, and we will also discuss psychoanalysis, which is his method of helping people with pathologies. Remember, he is only interested in the pathological person. He was not interested in the normal, healthy individual. Psychoanalysis may be a method of helping people with pathologies, and it was his approach to therapy, so it is also part of his theory. First of all, let's look at the history of Freud. He was born May 6, 1856 in Moravia, which was a part of Czechoslovakia. His mother was 21 years old, which was a little old to have the first child for that part of the world, and at that time, and Sigmund was her first child. He became his mother's little prince, spoiled rotten. He was a mommy's boy. It is said that his father had a great sense of humor, so Sigmund cannot use his father as a reason for his own lack of humor. Sigmund Freud was Jewish. However, he believed religion was an illusion and was not a practicing Jew. At an early age, Freud walked in on his parents in bed in a full sexual embrace and was ordered out of the room by his irate father. His father's emotional outburst made the memory a flashbulb event, and the incident would affect him for years, and was probably the reason his theory is called the psychosexual theory. In another significant event in his life at a very young age, he wished for his little brother to die. And when his brother did die, he made the mistake of most small children and connected the pieces. He wished for it to happen, so it must be his fault. The family moved when he was 4 years old to Vienna in Austria, where as an adult he would have citizenship. Freud was a brilliant child and excelled in his schoolwork. He received his MD at age 25, which makes him a medical doctor. As a doctor, that makes him a psychiatrist, not a psychologist. His major professor in school believed in reductionism. Reductionists believe that all behavior can be reduced to the biochemical energy that produces those behaviors. Reductionists attempt to find the link between behaviors and biochemistry. Freud was a reductionist in the first years of his professional life. Freud studied with Charcot after his schooling. Charcot studied the effects of mesmerism, which we now call hypnotism, on hysteria. In other words, he used mesmerism on his hysterical patients to try to cure them. Although Freud used mesmerism in therapy, he found its effects to be temporary and later gave up the use of mesmerism for a more conscious talking cure, now called psychoanalysis. Later in his career, Freud was director of a children's ward, so he got to know pathological children and their behavior and thoughts very well. Freud also thought he would be famous and had a very strong desire to become well known. He was always looking for that thing which would give him acclaim. In med school, he experimented with a chemical compound which he thought would make him famous. He found that it heightened the senses, it increased sexual feelings, and it removed depression. It also gave the user a lot of extra energy. He and a coworker studied the chemical closely in the laboratory. When Freud was on an extended leave, his co-researcher took credit for the work in a paper without Freud's name on it. Freud was extremely irate and upset for a short time, but the other guy got the blame for releasing cocaine onto the world, so it saved Freud the embarrassment. Yes, they were experimenting with cocaine. Although cocaine had a very good effect in small doses, the user became habituated to those responses and had to take more and more cocaine. In higher doses, it causes paranoia and many other negative side effects, as well as becoming extremely addictive. Freud finally did become famous when he published his book on dreams, and that is what made him known worldwide. His mentor and friend was Dr. Joseph Brauer, who's Jewish, and they had a patient in common they wrote about that they called Anna to protect her real identity from 1880 to 1882. Anna was also Jewish, and you will see why this is important later in this lecture. Brauer was a friend of Anna's family and took on the case of Anna because of his association with the family. Anna was at the time 21 years old and had hysteria, also known as a conversion disorder. She had episodes of spontaneous hypnosis, which she called chimney sweeping. Freud and Brouwer used mesmerism with Anna. She could recall emotional events in her life under hypnosis, and that would give meaning to the symptoms, which she could then control. For example, she stopped drinking water. During one of her hypnosis sessions, she remembered she was at a party where a man was sitting in a chair drinking water. He put the glass of water on the ground next to him, and while he was not looking, a mongrel, flea-bitten dog drank from the glass. The man later picked up the glass and drank from it also. It so disgusted her that she did not drink water again until she recalled the event. Freud said that this released the emotions involved with the event in what he called catharsis, which comes from the Greek word meaning cleansing. Freud also noticed that although the event changed her behavior, Anna did not remember the event. It was repressed. And once she remembered the event, she could consciously decide to let it affect her no longer. Remembering the actual emotional episode allowed her to expunge it. Freud learned from this experience. Freud believed that unknown, unconscious emotions were at the heart of Anna's hysteria. He determined that everyone with some pathology had repressed memories and emotions, and they needed to be dealt with to remove the pathology. Anna did not like being hypnotized, and she convinced Brouwer to use her chimney sweeping episodes as a part of the treatment. Brouwer would simply talk to her, and she would say whatever came into her head. This would later be called free association. Unfortunately, Anna was in love with Dr. Brouwer, but he was married, and he gave up on Anna after she had a spontaneous hysterical false pregnancy. She went through all the symptoms, but was not pregnant. Freud attributed these feelings to Anna's sexual frustrations and sexual energies. Brouwer agreed with Freud, which gave him validation. He then determined that all unconscious emotions must stem from sex. Remember his experience with his father as a child? Freud is so enamored with the idea that sex is the basis of all pathology that he eventually loses many of his followers who believed he went way overboard in attributing all causes to sex. In this one patient, we see the beginnings of Freud's theory. We see repression, free association, sexual energies, catharsis, and even transference. Freud published a paper about Anna, which was very well received, and gave Freud one of his first experiences of being famous. After spending a number of years in a psych ward, Anna recovered and was released and started the League of Jewish Women and became the very first social worker in Germany. She was even memorialized in a postage stamp in Germany for her accomplishments. Freud had 6 children. His last, and the only one to follow in his footsteps, was a girl named Anna. Now, where do you suppose he got that name? Freud wanted no other children after Anna. He felt that oral sex, homosexuality, masturbation, and any other form of sexual gratification other than the missionary position in a husband and wife intercourse were immature and unacceptable. So, he became a celibate and went without any sexual gratification for years after Anna's birth. Freud had a great ability to make friends. He also had an excellent ability to make his friends into enemies. He needed others to totally agree with him. He needed 100% acceptance. Can you see his mother's smothering influence here? He needed to be in charge. He refused to accept any criticism of his theory. This also meant he accepted no additions or subtractions from his theory. He hated Americans. He went to the U.S. on a trip in 1909 at the insistence of G. Stanley Hall. He was paid $714 to do 5 lectures at Clark University for their 20th anniversary as the second graduate school in the United States. Freud brought Carl Jung with him. This series of lectures also included William James and Cattell. So you had G. Stanley Hall, Cattell, William James, Sigmund Freud, and Carl Jung all in one place. When he arrived, he was greeted by ordinary Americans waving the German flag. Now remember, he was Czechoslovakian and he considered himself Austrian. He couldn't believe the stupidity of the Americans to be waving a German flag to greet him. He attended a barbecue where the Americans cooked in a pit on the ground, and he considered this horrific, barbaric. However, he was impressed by the learned men at the conference, and these lectures were discussed in the newspaper in America, which finally brought him fame in the United States. He moved to England before World War II to escape the Nazis, and in England he continued writing and practicing psychiatry. He smoked cigars all his life. Most of the pictures of him include a cigar. This gave him mouth cancer, and after many surgeries on the cancer, it killed him in 1939. And that's it for the history behind Freud, and we'll take up the theory in the next lecture.